Last weekend, Queensland closed its borders to New South Wales in an effort to make life easier for residents living on the border. The state government announced a border bubble, but we do hear that this is now having the opposite effect. Workers, particularly in healthcare, we've heard reports of doctors waiting up to 8 days after applying for an exemption from the mandatory 14-day quarantine required upon arrival back into Queensland. Now, this mainly applies for doctors who are from Queensland and have business outside of the border bubble in New South Wales. Now, Sky News also understands that some of our major hospitals in northern New South Wales are struggling to fill their overnight shifts because of this. We know that last weekend, Casino Hospital, it had to call in a nurse who was trained in emergency care because a doctor couldn't make it on site. Now, we know that our Chief Health Officer, Dr. Jeanette Young, is warning residents who do live on the border to come up with a backup plan if we do see that border closure, that hard border closure, come into effect. Contingency plans are right now underway by police on either side of that border. And Charlotte, to make matters worse, certainly adding the fuel to the fire, reports yesterday that 4 people tried to illegally enter Queensland on a sailboat. They sailed from Byron, tried to get up to Cairns, and they were intercepted, as we just heard from the Premier, fined a hefty $4,000 each, put into mandatory hotel quarantine, and 2 of those people are now in hospital in Townsville.